How you doing?
I'm good.
Okay, my name is Lydia. I am a student, nurse practitioner with UT Tyler, and today I'll be performing a physical assessment on you today. Okay?
Okay.
Can you please tell me your name and date of birth?
JB,
How?
10 of February 1990.
Okay. What do you do for a living?
I'm an engineer.
Okay. So what brought you in today?
Yeah, I have a problem with my right knee.
Okay. When did it? What happened?
I was playing soccer there also like 3 days ago. So
Okay.
now I'm tripping from.
Okay. On a scale of 0 to 10, how would you rate your pain?
6.
Okay, before we go ahead and address the pain to your foot, I'm just going to go ahead and do a quick head to toe assessment on you, okay?
Okay.
I can see you're comfortably seated, no anxiety, notice. If at any point of the procedure you feel uncomfortable, you feel you need to take a rest, just let me know, okay?
Okay.
I'm going to start by inspecting his head. I can see his head is upright. It's not tilted to the left or right. It's centered. Looking at his hair is clean. I don't see any nits or ticks in there. Also looking at the hair texture, it's evenly distributed, no random area of alopecia. I'm going to palpate the hair from the front to the back, feeling for lumps and bumps. Any tenderness?
No.
Okay, no tenderness. I'm gonna inspect his face. Looking at his face, I'm observing for lesions on the face. There's no color variation. If there were any lesions on the face, I'm gonna observe for the symmetry. Which there shouldn't be any variation in the symmetry. I'm gonna check the borders of the lesion. I'm also going to check the color. There should be no color variation. The diameter shouldn't be more than 6 millimeters, and the lesion shouldn't be evolving. Okay. Go ahead and puff your cheeks out for me. Make a frown. Okay. I didn't notice any asymmetry with a frown on his face. No asymmetry with a frown on his face. If there were any asymmetry or weakness on one side of his face, I would suspect stroke or Bell's palsy. Alright, looking at his, I'm gonna inspect his eyes. Looking at his eyes, check the eyebrows, it's symmetrical, well centered, no coarseness of the eyebrows. The superior eyelids is partially covering the iris. The eye line, there are no crustiness on the eyelid or flakiness. There's eyelids on both there's eyelashes on both the eyelids, and it's turned outwards. I'm gonna palpate. Any pain?
No.
Okay, looking at the conjunctiva, it's pink and moist. The sclera is white, it's not yellowish or jaundice. Okay, next I'm gonna inspect the eyes. Okay, I'm just checking for opacity, the lens and cornea for opacities, and also the size of the pupil, and also the shape. Okay, the pupil is, I can see the pupil is round, regular, and equal on both sides. Next, I'm gonna do check for visual acuity. Okay. All right. Okay. Clinically, you're supposed to be 6 feet from the patient, but I'm gonna stand here, and I'm gonna stand about 2 feet away. So you're gonna read the lines for me. Cover your right eye.
A, F, T, Z, O.
Okay, cover the other eye and read for me.
E, Z, T, Z, O.
Okay. He was able to read the letters clearly, and his vision is 20/20, and he has on corrective lenses. Okay, I'm gonna do cover and uncover test. All right, go ahead and cover your right eye. Look directly at the wall. Go ahead and cover the other eye. Okay. While I didn't notice any wandering or movement of extra movement of the eyes while he was performing the cover and uncover test. If there were any extra movement, I would suspect strabismus. Okay, I'm gonna check for visual fields of confrontation. Okay, go ahead and cover one of your eyes, your right eye. I'm gonna cover one of my eyes. You tell me how many fingers I'm holding up. Okay.
1, 2, 1, 2,
Okay, cover the other eye.
5, 2, 3, 2.
Okay. There was full confrontation in all the fields, no abnormal confrontation detected. Okay. Next, I'm gonna perform the 6 cardinal field of grace. Okay, I'm gonna focus on the pen on this object. Okay. Any difficulties while performing that?
No.
Okay. His movement was smooth and coordinated, no abnormal eye movement. Next, I'm gonna perform the corneal light reflex, the Hirschberg. Okay, can you take off your glasses for me? Okay, I'm gonna concentrate the light at the bridge of the nose. Just look the wall directly behind. Okay, movement was there was a symmetric light reflected from both of the eyes and it was centered. Okay, next I'm gonna perform pupillary light reflex. All right. Usually, clinically, the room was supposed to be dim, but I'm gonna use my hands on the side. Okay. There was direct pupillary response and also consensual response of the opposite pupil. I'm gonna test for accommodation. Focus on the subject. Focus on the wall. And back to the object. Okay. There was constriction of the pupils as he focused on the object that was directly in front of him. All right. So the pupils were equal, reactive to light and accommodation, which is perla. All right. Next, I'm going to perform a fundoscopic exam using the ophthalmoscope. Okay. I was able to identify the red reflex bilateral in the bilateral eyes. The optic disc was sharp and had clear margins, and the retina, I could observe the blood vessels and no exudates or hemorrhages bilaterally. Okay. Next, I'm gonna palpate the temporal. Any tenderness?
No.
Okay. I'm gonna also do it and listen. Using the bell of a stethoscope, I didn't listen. I didn't hear any words. Looking at the nose, the nose is well centered, symmetrical, no deformities. Can you go ahead and close your right nostrils for me? Breathe in and out. The left, breathe in and out. Okay. Any difficulties breathing?
No.
Okay. There was a free flow of air in and out. Both nostrils. Okay. Go ahead and cover. Close the right nostrils. I'm gonna test the olfactory. Okay.
Okay.
Okay. Close the other nostrils.
Point it out.
Okay. He was able to identify smells in both nostrils, so his olfactory smell is good. Okay. I'm gonna do finger to test. Finger to nose test. Okay. Close your eyes and touch your finger. Do it fast. Okay. The finger to nose test was coordinated and no uncoordinated movement observed. All right. Next, I'm going to examine the nose. Okay. Looking at his, examining his nose, I observed there was, of course, hairs anteriorly. The turbinate was light red. no polyps, no foreign body, no excessive exudates, no lesions, or any abnormal findings noticed. Okay, both in both nostrils. I'm gonna palpate the maxillary sinuses. Any pain?
No.
Okay. Next, I'm gonna observe the ear. Looking at the ears, they are both symmetrical, aligned with the eyes. No lesions noticed, no exudates, no drainage. I'm gonna palpate for lumps and bumps. Any pain?
No.
Okay. I'm gonna examine the ears too. Okay. I'm gonna examine one ear. Okay. Examine the other ear. Okay. So examining both ears, there were externally no excessive hair on both of the ears, no cerumen, no excessive cerumen, no foreign bodies, no drainages. I did observe the tympanic membrane. It was pearly gray in both of the ears. No perforations, no tears. The the cone of light was visible, and there was movement of the membrane bilaterally. Okay, I'm gonna perform a whisper test. I'm gonna whisper some words to you and tell me what you hear. Okay.
Apple.
Say that aloud. Okay. 99.
99.
Okay. Was able to respond to whisper words and bilateral ears. I'm gonna perform the Weber test using the tuning fork. Tell me, just say no when you stop hearing the sound.
No.
Okay. Did you hear the sound in one ear, in both ears, or none at all?
Both ears.
Okay. Able to hear the vibrations and the tone in both ears. I'm gonna perform the Riley test. Tell me, stop hearing the sound.
No. No.
Okay. I'm gonna perform the same Riley test on the other ear.
No. No.
Okay. He had a positive Riley test. Air conduction was greater than bone conduction. Alrighty. Okay. So next, I'm gonna palpate. I'm gonna inspect the mouth. Looking at the mouth is moist and pink. There is no dryness, no cracking, no ulcers, or no lesions. Can you go ahead and swallow for me? I want to observe your swallow. Okay, that is good. Okay, I'm gonna do inspection. I'm gonna do a frontal inspection of the mouth. Okay. Okay. So go ahead and put your tongue out for me. Okay, looking at the tongue, I can see the tongue is pink and moist. It's symmetrical. There are no tremors on the tongue. I can see the dorsal surface of the tongue, some fissures on there, some mild groove. Touch the roof of your mouth with your tongue. The ventral surface of the tongue is pink and moist. with blood vessels coming forward. Okay. Looking at the oral mucosa, I can see it's pink, no lesions, no nodules in there. The teeth has yellow coloration, which is normal. The gums are pink. The gums are pink, no bleeding in the gums. Say R for me. Okay, I can observe the hard palate is bony and white. The soft palate is muscular and pink. I can also observe the uvula, it's midline. The pharynx and the tonsils are all pink and moist, no lesions noticed on them. Okay, I'm just gonna go ahead and just feel. Okay, no lesions felt in there. Okay, thank you. Okay. All right. So next I'm gonna palpate. I'm gonna palpate the nodes of the face. The lymph nodes of the face: pre-auricular, posterior auricular, occipital, tonsillar, submandibular, and submental. Okay. Here, turn your neck to one side. You have the posterior cervical. You have the superficial cervical. I have the deep cervical. I have the supraclavicular lymph nodes. Any tenderness?
No.
Okay. Now I'm gonna inspect the neck. Looking at the neck is symmetrical. I don't see any lesions, any excessive skin fold, any webbing of the neck. I'm gonna go ahead and do range of motion. Okay, turn your neck to the left, right, left. Extend your neck backward, chin to chest, ear to shoulder, ear to shoulder, the other ear to shoulder. Okay, I'll try to go against the other way around. Okay, the strength is good. Go ahead and shrug your shoulders. Okay, all right. I'm gonna extend your neck backward. I'll feel for the trachea. The trachea is midline. Okay, I'm gonna also assess the thyroid gland. Okay, feel for the thyroid. I don't feel any nodules on there, any lumps or bumps. Okay, so go ahead and face the camera. Okay, hold this. Feeling for the extend your neck, feeling for the thyroid. Go ahead and swallow. Okay. Okay, those movement of the thyroid as he swallowed. He didn't swallow water. Okay, go ahead and sit. Okay. Next, I'm gonna go ahead and inspect the anterior chest. I can see he's comfortably sitting. Breathing is easy and regular. No distress with breathing. There's no nasal flaring. I don't see any skin lesions. There's no pigeon chest or funnel chest. Okay, you just stay still for me, and I'm gonna observe your respiration. Okay, clinically, observe the respiration for a full minute. Okay, so go ahead and turn and face your back to the camera. Okay, I'm gonna go ahead. And palpate for tactile firmnesses. Okay, whenever you feel my hand on your shoulder, you say 99. Okay.
99, 99, 99, 99.
Okay, vibrations were felt equally they were equal, and vibrations were on both sides. Okay, I'm gonna palpate for diaphragmatic expansion. I'm gonna place my fingers at T between T10 and T9. Okay, taking a deep breath in and out. Again. Okay, lung expansion is equal and symmetrical on both sides. I'm going to palpate for diaphragmatic excursion. Okay. I'm going to palpate for diaphragmatic excursion. Okay, so I'm gonna pick us for diaphragmatic excursion. I'm gonna start from area of high resonance to where I hear the first donors. Okay, so taking a deep breath and hold. Okay, I'm gonna go ahead and mark it. Exhale, breathe normally. Okay, I'm gonna go from here to a new area of dullness. I'm gonna pick up from here to new area of dullness. Okay, taking a deep breath, exhale and hold. Okay, I'm gonna mark it right here. I'm gonna do the same on the other side. Okay, taking a deep breath and hold. Okay, mark it here. I'm gonna pick us downwards to a new area of dullness. Okay, exhale and taking a deep breath, hold. Okay, breathe normally. I'm gonna go ahead now and measure. Okay, diaphragmatic expression measured 5 centimeters and is equal on both sides. Okay, I'm gonna go ahead now and test for costal vertebra tenderness. Okay, right here. Tell me if you feel anything. Okay. Anything?
No.
Okay, no pain at the costal vertebra angle. Okay, I'm gonna auscultate for for the long sounds. Breathe in and out. Okay. The long fills were clear. To breath sounds and no consolidations, and I didn't get any no adventitious breath sounds heard, no crackles, no stridor, no ronchi heard in any of the any reason heard in any of the fills. Okay, I'm gonna test for egophony. You go ahead and say A for me, okay? Okay. The air sound was heard throughout auscultation of the lung fields, and at no point did I get the A sound during auscultation, which is a normal finding. Okay, go ahead and sit straight up for me. So I'm gonna go ahead now. I'm gonna palpate the anterior chest for tactile firmities. Whenever you feel my hand on your chest, you're gonna go ahead and say 99. Okay.
99, 99, 99, 99.
Okay. Vibrations will feel equally, and it's symmetrical. All right. I'm gonna go ahead now and quick us. All right. Okay. There was a tympani head over long fields and dullness over the diaphragm. I'm gonna go ahead now and listen. Okay, breathing that out for me. Okay. Okay, long fields were clear to auscultation, no consolidations, and no adventitious breath sounds heard. There was no wheezing, no crackles, no ronchi, and no stridors heard. Okay, I'm gonna listen for egophony. Go ahead and say A for me. Okay, the S sound was E sound was heard. You have to say E.
E, 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 E.
Okay. The E sound was heard throughout the lung fields, and the A sound wasn't heard while auscultating the lungs. Okay, so right now I'm gonna feel for diaphragmatic excursion. I'm gonna place my expansion, place my finger at the costal vertebra angle, and my fingers towards the xiphoid process. Go ahead and breathe in and out. Okay, diaphragmatic expansion was equal and symmetrical on both sides. All right, so now I'm gonna ask you to go ahead and lay down for me. Go ahead and lay down. All right. Clinically, he was supposed to be laying 30 degrees angle. For the sake of this video, I'm using the pillow to simulate that. Okay. Turn your head to the left. Okay, I'm gonna be examining the jugular for jugular JV jugular vein pressure and carotid pulse. Okay. There's no abnormal pulsation or distension of the jugular vein. Okay, this way. No abnormal pulsation or distension of the jugular vein. Okay. Alright. I'm gonna go ahead and feel palpate the jugular vein one at a time. Okay, this other way. Okay. I'm gonna auscultate for breath. You're gonna take in a deep breath and hold. Okay. Take in a deep breath. No breath heard. Taking a deep breath and hold. Okay. No breath heard while auscultating using the bell of the diaphragm. All right. Next, I'm gonna go ahead and palpate the chest for tenderness, for hips and trails and lifts. Okay. And I'm also gonna inspect. Looking, I don't see any lesions. I don't see any discoloration of skin, discoloration. Looking at observing the point of maximal impulse, which is the mid clavicular line at the feet intercostal space. I don't see no pulsation, which is normal. So I'm just gonna palpate for the point of maximal impulse for the pulsation. I don't feel any pulsations on there. Okay. I'm gonna palpate for lifts and trills and lifts and tenderness. Any tenderness?
No.
Okay. I'm gonna palpate the pericardium. I'm gonna palpate starting from the base, the left sternal border, and also palpate I'm going to palpate the apex, the left sternal border, and the base. Okay. Next, I'm going to auscultate. I'm going to auscultate the heart sounds. I'm going to auscultate the aortic sound, which is found at the second intercostal space on the right sternal border. The pulmonic, which is found at the second intercostal space left sternal border. The herbs and tricuspid found between the second, third, and fourth intercostal spaces on the left sternal border, and the mitral is found at the fifth intercostal space mid clavicular line on the left. So I'm gonna auscultate using the bell. While here, I'm going to auscultate for the pulse of maximal impulse for 1 minute. Clinically, I'm supposed to auscultate for 1 minute, but for the sake of this video, I auscultated for accounted for 30 seconds, and the pulse is regular, and the rhythm has a regular is 80. The rate is 82, and the rhythm is regular rhythm. Okay. Next, I'm gonna go ahead and continue with the examination of the abdomen. Okay, is it okay? Can I lift up your?
Okay.
Okay, I'm gonna inspect the abdomen. Looking at the abdomen, I don't see any striae. I don't see any masses, any lumps, any lesions on the skin. The umbilicus is inverted and it's midline. I'm gonna observe the abdomen at an eye level. Also looking at this level right here, I can see the breathing is easy while observing the abdomen. Also I can see there's no abnormal breathing pattern. Go ahead and lift your head. Okay, any pain?
No.
Okay. He expresses there's no pain while performing. Go ahead and relax. Okay, while he was lifting his head, I didn't notice any protrusion, any lumps, or any abnormal findings on there. Next, I'm gonna auscultate for bowel sounds. Normally I'm supposed to listen for about 5 minutes to see if there are no bowel sounds. So I'm gonna listen. I'll start listening from the right lower quadrant, right upper quadrant, to the left upper quadrant, and the left lower quadrant. Okay, bowel sounds heard, and they are active and not no abnormal bowel sounds. Next, I'm gonna listen on the abdomen. I'm gonna listen for the blood vessels. I'm gonna listen with the bell of my diaphragm. I'm gonna listen to the aortic artery. I'm listening to the right renal, left renal, to the left iliac, and the right iliac, and then the bridge. And I'm just also going to go ahead and listen to the right femoral and the left femoral right here, and the bridge also heard. Next, I'm also going to do a scratch test. Okay. Okay, performing the scratch test is to determine the liver border, and the liver border is right here, the costal, like 2 centimeters below the costal vertebral angle, right here, which is a normal finding. Next, I'm gonna percuss. The 4 quadrants. Of percussion, there is generalized tympany and scattered dullness over the 4 quadrants of the abdomen. Next, I'm going to percuss to determine the liver, the borders of the liver. I'm going to start from the right upper chest, right here, and percuss downwards to where from tympany to dullness. I'm going to mark it. And I'm going to percuss from downwards right here. I'm going to mark it. I'm going to measure it. And it measures 7 centimeters, which is a normal finding. Next, I'm going to percuss the spleen. From the mid axillary line. Okay, go ahead and look at that. Auscultation of the spleen reveals some tympany. If there were donors, it will be an abnormal finding. Next, I'm going to do live palpation. Okay, tell me if you have any pain. Okay.
No.
Okay. Next, I'm going to do deep palpation. Any pain?
No.
Okay. Next, I'm going to palpate the liver borders. Taking a deep breath for me. No, I don't feel any pain. Any pain?
No.
Okay, I'm going to palpate the spleen. Taking a deep breath. Any pain?
No pain.
Okay. Also, no pain on palpation of the liver on the spleen. Okay, next, I'm going to do lower extremity. I'm gonna examine his lower extremity. Looking at his lower extremity right here, I don't see his skin is warm. His skin there's no variation in color, no lesions on there. There is even hair distribution. I'm gonna feel for the temperature. The temperature is warm. I'm gonna feel for I'm going to also feel for capillary refill, less than 3 seconds. I'm also going to feel for palpate the pulses, especially pedis pulses. It's regular in rate and rhythm bilaterally, posterior pedalis. It's regular in rate and rhythm bilaterally. I'm going to feel for edema. No edema on the anterior tibia. There's no edema. Also going to feel the popliteal pulse. Okay. It's regular in rate and rhythm bilaterally. Okay. I'm going to palpate. I'm going to feel for the radial pulse. It's regular in rate and rhythm bilaterally. The brachial pulses, regular in rate and rhythm bilaterally. I'm gonna feel for the lymph nodes. Right here, the inguinal lymph nodes, bilateral lymph nodes, no tenderness, no swelling, any pain?
No.
Okay, the epitrachea, right here. Any tenderness and pain?
No.
Okay. The axillary right here. Any tenderness and pain?
No.
Okay. No tenderness and pain felt over the white palpates in the lymph nodes. Okay. Okay. I'm gonna ask you to open and close your mouth for me. Open. Any pain? Close it.
No.
Okay. The temporal mandibular joint. No tenderness and pain while palpation of the temporal mandibular joint. Okay, and I'm gonna go ahead and perform range of motion of exercises. Okay, just go ahead. Okay, outward, inward. Okay, anything?
No.
Okay, eyes on the foot. Any pain?
No.
There's pain on this foot?
Yeah.
Okay. He came in complaining of pain on the left knee, so range of motion is quite limited on the left foot. Okay, I'm gonna go ahead and check for strength. Okay, push against my hand. Okay, push up, try to push up. Okay, push up. Okay, all right, I'm gonna feel for the draw test right here. Okay, I'm gonna try so I'm gonna do the draw test, push. I'm also gonna do the McMurphy's right here and out. Okay. Also gonna do the Lashman test to check for the laxity of the knee joint. Okay. So input. Okay. Able to perform the Lashman test. Okay, I'm gonna check on this foot to see if I can do that, okay? Alright. You able to? Okay?
Okay.
strength on the left foot, the McMurrays, and the Latchman, and also the athletes on the left foot because complaining of pain on the left foot. Okay, I'm gonna try to perform this here. See the upliftment in, out. Okay. Alrighty. Alright, sit up for me. No, please, sit up. Yeah, just leave them with it. I'm gonna do plantar reflex. The toes. Plantar reflex reveal no fanning of the toes bilaterally. Okay, sit up. Okay. I'm gonna do just put your foot up. I'm gonna do the patellar reflex. Okay, and the Achilles. Okay, patellar reflex. Okay, and the Achilles. Perform both a plantar and Achilles reflex, which were all within defined limits. Alright. I'm going to observe the skin, the upper extremities. The skin is moist and warm, no excessive dryness. They even hair distribution of the skin. Go ahead and put your fingers like this. I'm going to ask them for looking at the no clubbing of the fingers, looking at the nails. The nails are clean. No abnormalities in the nails, no deformities of the nails. I'm going to perform a range of motion of the fingers. Anything?
No.
Okay, go ahead and extend both arms. Okay, go like this. Please stretch there. On the other side. Okay, extend your arms this way. Flex. Extend. Rapid movement is coordinated. Okay, extend, upwards, open, close it. Okay, so now I'll ask you to, I'm gonna push, try to strength, push. Okay, open your arms. Okay, try to go against. Okay, then now your feet. Try to push, push. Okay, that's good. Push, 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 push. Okay, that is good. Go ahead and stand up for me. Okay, I want you to walk to the camera and back. Okay. Okay, movement is coordinated. Use your go back, walk heel to toe. Okay, movement is coordinated. Going back, use the tip of your toes. Okay, use the heels coming back. Okay, go back. Movement is coordinated. His movement is coordinated and smooth while performing the heel to toe and walking on tippy toes and on the heels. Okay, I want you to go just kind of squat for me a little bit. Okay, alright. I'm gonna test for, that's good. I'm gonna test for stereo nurses. I'm gonna place, close your eyes. I'm gonna first of all do Rombergs. Close your eyes. There's no swaying or excessive swayness while performing the Romberg. Okay, go ahead, open your eyes. I'm gonna test your spine. Touch your knees, touch your feet. Okay. Spine is symmetrical. If it were asymmetrical, I would be thinking of scoliosis, which is not. Okay, sit up. Okay, twist to the left, twist to the right. Lean on one side, on the other side. Okay, go ahead and sit down for me again. Okay, I'm gonna place an object on your. Close your eyes. Place an object in your hand. You tell me what it is. Close it.
keys.
Okay. Was able to recognize key with stereognosis, which is good. All right, Mr. JB, I'm done with my physical assessment, and I'm gonna go ahead now and address your knee. I noticed you weren't able to perform the range of motion of your feet, of your knees, the Apley's, the McMurray's, or the Latchman test. I'm gonna go ahead now and do further assessment. Okay.
Okay.
Is there anything else I can do for you?
That's okay.
Okay. Thank you so much for your time. I appreciate it.
Thank you.
Okay.